Good Tuesday morning, everybody. My name's Anna Palmer. I'm the CEO and one of the founders of Punchbowl News. I want to welcome you this morning to the half-day summit, The Future of Rural Healthcare. A native of North Dakota, this is an issue that I am very familiar with and am looking forward to hearing us discuss, particularly as we explore healthcare in rural communities. I'm going to be sitting down one-on-one with Senator Tina Smith, the Democrat from Minnesota. We'll also talk with the chair of the Coalition to Strengthen America's Healthcare and CEO of Carilion Clinic, Nancy Howell Agee, about why patient access to quality care is so important, particularly in rural communities. And we're going to close out this morning with a panel discussion of healthcare industry leaders. I want to thank the Coalition to Strengthen America's Healthcare for partnering with Punchbowl News and making today possible. I also want to thank all of you in person as well as on the live stream for joining us this morning. As always, you can find Punchbowl News on all social media platforms at Punchbowl News, and we encourage you to share about this conversation. Keep it going beyond the conversation in the room today. And with that, I'm going to welcome Senator Tina Smith to the stage. Senator Smith. All right.
Thanks, Anna.
Yes.
What beautiful flowers.
I know. I have to take that home.
I feel sort of excited to be here for a lot of reasons, but one of which is that, of course, I start my day every day reading Punchbowl, the roundup in the morning. So well, here we are.
Thank you so much. We appreciate that.
Yeah.
We are going to start this morning, as we always do, with a few news of the day questions before we get into the topic. There's no shortage of things. You're coming off of a 2-week recess, and the Senate has a very busy calendar, everything from FISA to foreign policy, and that's where we're going to start this morning on foreign policy. There's a lot of pressure about finding a pathway forward on Ukraine funding, which would also include money for Israel. Talk about the Israel provisions. Do you think they're trickier now given the changing political dynamics? I mean, it was supposed to be kind of the sweetener to get Ukraine done, and that's really changed.
Well, I think the dynamic has changed a lot, and of course we know that a lot of this is really up to what the U.S. House of Representatives does right now. Those of us in the Senate, of course, believe that the U.S. House should just take our bill and pass it. That's not just our Senate parochialism, it also is the fact that the bill passed with broad bipartisan support in the Senate, and we know that if the Speaker would put it on the floor, that it would pass with broad bipartisan support in the House as well. We also understand that he's got some particular challenges, and we don't know exactly what that would mean for him. I do think that there are so many reasons why waiting longer to get this done makes it harder and not easier. The number one thing on my mind, of course, is how desperately Ukraine needs this support. I mean, Putin will win. Ukraine will lose if we don't get this funding done.
Let's talk, we're going to switch topics quickly to the big push on banning TikTok in the United States Senate that passed the House, so now it's up to the Senate to act. Senate Minority Leader Mitch McConnell weighed in support of that on Monday. Mm-hmm. Do you support the TikTok ban bill? And more broadly, do you think that social media bans on children under 13, like your colleague Senator Schatz have proposed, can actually work?
Well, so I'm not on Senator Schatz's bill or these other bills, though I have to say I have great concerns about the impact of social media on young people's mental health. I have very high regard for our Surgeon General, Vivek Murthy, who has written so compellingly about the impact of this. The TikTok bill, I'm actually not I'm still looking at this. I haven't decided exactly where I am on this, though I do really believe that the ways in which the PRC can use TikTok potentially to spy on Americans is something that we have to take very seriously.
All right, we're going to talk about rural healthcare in a minute, but before we do, I'm going to zoom out a little bit and just talk about healthcare generally. In particular, former President Donald Trump has threatened to repeal Obamacare. How big of an issue do you think this is going to be in the 2024 election, or is this settled law?
Well, I think that the Affordable Care Act and Obamacare is settled law in large part because Americans really like it. Americans like the idea that you can't be denied health care because you have a pre-existing condition. They like the fact that many millions more Americans are able to get health insurance because of the Affordable Care Act. The exchanges are working in Minnesota and around the country to help people be able to affordably buy health insurance. And if you're about to turn, if you're 24 and you're not going to get kicked off of your parents' health insurance. So there's so much about it that people like. But this is, again, a fundamental difference between President Biden and former President Trump in terms of how healthcare would work in this country.
Another issue, abortion, has clearly become a major rallying cry for Democrats across the country. In addition to serving as the senator from Minnesota, you also serve as co-chair of the DSCC, which is the Democratic Senate Campaign Committee, so the political arm. How do you think abortion is going to play out in some of these marquee Senate races? GOP candidates have been kind of all over their map. There isn't a universal kind of response when it comes to abortion. Trump is now saying that it needs to be a states' right issue. We're seeing this in ballots across the country, particularly in Florida. What do you see there?
Well, so the issue of reproductive freedom is a galvanizing issue for Americans, and that is why it is such an important issue in the campaign. People believe that they should have the freedom to decide for themselves about their health care, including abortion, without politicians or judges interfering. And that is has been crystallized by what Donald Trump did to take away those rights with what happened with Roe being overturned in the Supreme Court. So from my vantage point, looking at these really interesting, challenging, but very winnable races in Ohio with Sherrod Brown and Jon Tester in Montana, what you see is this is an issue that kind of cuts across party differences. And Montana is a great example. It's a pretty libertarian state. Montanans don't like other people telling them what they can and cannot do. And so the sort of anti-abortion Republican candidates are dramatically out of step, even with Montanans, which you think of as being a pretty red state. It is a red state. Donald Trump won Montana by 30 points or something?
Right.
So, but Jon Tester is going to win. With Trump voters, and it's going to be in part because he's on the right side of Montana voters on this issue.
All right, let's talk rural health care. You are co-chair of the Senate Rural Health Caucus, and the issue is crucial in your state. We were talking about that before we got on stage. Set the stage for us. What barriers do you see when it comes to rural health care access, particularly in a state like Minnesota?
Yeah, well, so it's interesting. Obviously, access to healthcare is foundational to thriving rural communities. And I think that rural communities, small towns and rural places, see many of the same challenges that we see broadly in healthcare, but the challenges are greater. So what are the big challenges? I think there are 4 of them. One is just the cost of providing care. 2, related to that, are the big workforce challenges, a real shortage of workers. 3, you have a real challenge, we need to address the equity problems that we have, and you see that in rural communities as well. And then you just have to remember that healthcare is economic development for rural communities. So there are a lot of challenges, but there is also some tremendous innovation that's happening in rural communities around healthcare. Telehealth is one very notable example. And so I think what we have to do is to lift up those innovations and make sure that we have enough flexibility in the system so that those rural providers can do what they know how to do best.
We're going to dive deeper into all of those issues. But before we do, I think one of the things, I was doing some research before doing this panel, and I think is maybe a misnomer or what maybe people just don't understand is how complex the population that rural health deals with. I think we often think of the challenges that more urban environments have, but the span of care, age, kind of things that hospitals and doctors are having to deal with in a rural community setting is pretty vast.
It's really true. Broadly speaking, rural populations tend to be older. They tend to be more poor. They are very, very diverse. We might have this sort of mental picture of a less diverse rural community, but that's not the case in Minnesota, where you have people from all over the world living and working in greater Minnesota. And so that definitely increases the challenges in some way. I think, but then that also creates the opportunity for more innovation. I'd love to talk to you about some of the cool things that are happening with rural hospitals in Minnesota. Partnering with Native communities is a great example of that.
Well, let's talk about telehealth. That's one of the innovations that we've seen a lot of discussion, investment in, particularly as it coming out of COVID, right? You recently reintroduced the bipartisan Telemental Health Care Access Act. What's its goal, and how do you think telehealth could fill some of those workforce challenges you talked about?
Well, so, if you live in a rural community and you need access to specialty care or including mental health care, I think the average time that you'd have to drive to get someplace is at least half an hour. And so that can be a real barrier. And there's a huge shortage of mental health care providers everywhere in this country, but especially in rural communities. And so what our bill does is kind of a classic, like, let's cut through some of the red tape to make things work better. There is currently a requirement in Medicare. Most populations who are accessing mental health care in greater Minnesota are older. There's a current requirement that you must have a face-to-face meeting within 6 months of getting care, or the provider can't be reimbursed. And that's just creating all sorts of problems. It should really be up to the provider and the patient when they have a face-to-face meeting, and not some bureaucrat in Washington telling them what to do. So that's bipartisan too. I'm doing that with Senator Cassidy from Louisiana and my colleague Senator Cardin from Maryland, and so I'm hopeful we'll be able to move that forward.
You can see how rules like that might have gotten put into place, with a good faith effort, but
Totally.
when you think about the reality of the challenges of traveling, 30 minutes is the average, but I think oftentimes some of these states, if you're going to VA care, if you're going to other care,
Yeah.
it can be hours.
Well, and you might be up in, Ely, Minnesota, and your provider might be in the Twin Cities, and that's 4.5 hours.
Right.
And the other thing that I learned from my constituents in Minnesota is that, in rural communities, the stigma around accessing mental health can be really high. And also, that you feel sort of exposed. You're in a community of like 2,000, 3,000 people or even smaller, and maybe there's 1 or 2 providers, and it might be the same person that your family is seeing. And you don't really want to park in the parking lot because everybody is going to see your car and they're going to recognize your car. And so I'll never forget the story that I heard from a Minnesotan who was really struggling, and she said, I can get my care from my bedroom, and that is a blessing because I don't think I can leave my house.
Yeah.
And so it is actually an innovation that was fueled by the pandemic, but is creating new ways for people to get care that I think are really, really valuable.
Another challenge and an effort that you've supported is kind of addressing rural housing challenges, right? As you think about providers, trying to attract them to some of these more rural communities that serve a lot of different areas, that could be one of the big challenges.
Absolutely. It's a challenge for recruiting providers to communities, but it is also, if you think about what contributes to health in rural communities, you've got to have access to housing, you've got to have access to healthy food, you need to be, 20% of people in rural America don't have access to broadband, so telehealth is sort of a figment of your imagination if you can't actually, you can't really make a connection. Housing in particular is so integral to whether people can live a healthy life. If you don't have access to a safe place to live, nothing in your life works. So the bill that I'm working on with Mike Rounds from South Dakota is just making sure that we are preserving the existing affordable housing that we have in rural communities, and again, cutting through some of the red tape that is making it difficult for those units to be there for people.
Mm-hmm. I want to shift gears a little bit to maternal health. It's a topic that a lot of people are focused on right now. You have also spent some time on it, including the Data to Save Moms Act, which would provide funding to study and address underlying causes of maternal health disparities facing Black and Native American women. What more needs to be done here? Why does this study, and what would it potentially illuminate?
Well, so we don't know enough about what are really the determinants of the very poor outcomes for maternal health that we have in this country, and very disproportionately affecting Black women, Latino women, Native women. I worked with my friend Lisa Murkowski to pass the Rural Moms Act, which we passed in 2022, which gets some at this data issue, but what it also does is to just provide ways for rural communities to protect the maternity obstetrics care that they have in their communities. If you're a small rural hospital and you are delivering maybe 100, 150 babies a year, you think about a big urban maternity center, there could be thousands of babies that they're delivering. It's really a challenge to be able to maintain a standard of care and maintain practice. If you're the OBGYN in that town and you're delivering almost all of those babies, that's a real challenge. You don't have any network, you don't have any connection. Just an example quickly of how well this Rural Moms Act is working is in Bemidji, Minnesota, kind of a regional center in northern Minnesota. And the Sanford Health Hospital there has created this maternity care kind of consortium that is working with leaders at the Red Lake tribal nation nearby and rural moms all around Bemidji to make sure that they are getting the prenatal care that they need, which is going to lower poor outcomes for childbirth and postpartum care. And it's really working to improve outcomes. It's exactly the kind of thing we need to be doing.
A theme I feel like we keep hearing is the work that you're doing in a bipartisan fashion.
Yes.
We often, in Washington, I think, you can become a little bit cynical of the process and kind of people in different camps, but this is a lot of work that you're doing with your colleagues on the Republican side of the aisle. How has that come about? Talk about that a little bit.
Well, not a single bill that we've talked about has been, all of them have been bipartisan. Yeah. And why is that? Well, one is because these aren't Democratic or Republican issues. They're issues that affect all of us. And every single one of us has large rural populations, and we're thinking about the challenges that those rural hospitals are experiencing. 50% of rural hospitals, last year I think it was, lost money. So many of them are just hanging on by a thread. And so it's a place where we can all look to find some common ground and opportunities to move forward. And it's great. Yep, and in Washington is sort of the tale of two cities. There's like this part of the city where we fight all the time, and then there's the part of the city where we work, and I like to live in the working part of the city.
I appreciate that. And you kind of mentioned it, but I want to dive a little bit on this, which is funding. One big issue when it comes to the solutions of some of these projects that you're talking about, or attracting people, or making sure that these hospitals are going to still be able to exist 5, 10, 15 years from now, is the funding. Can you talk about the underpayments of Medicaid and how that impacts rural hospitals?
So there are a lot of complex and interlocking issues when it comes to the funding crisis for rural hospitals. And one of them is making sure, doing everything that we can to make sure that Medicaid and Medicare reimbursements are, at least in some way, keeping up with the cost of care. And let's just be honest, that's not happening right now. We also need to protect programs like the 340B drug pricing program, which helps hospitals fill the gaps. When you talk to hospital administrators in rural America, they're usually describing this complex process that they're going through to try to braid together sources of funding to keep services going and to keep the hospital open. The other thing, though, I think we have to look at is how reimbursements and payments are working on the private payer side. And as Medicare Advantage programs have grown, over 50% of people in Minnesota are on Medicare Advantage. I hear all the time from hospitals, including rural hospitals, about how those lower reimbursement rates are making it even harder for them. And the stories that I have heard about rural hospitals having to devote teams of people to work to get their reimbursement, to work through prior authorizations, to deal with denial of care challenges and it just seems so inefficient to me.
Mm-hmm. Let's dial in on that a little bit more. Rural communities also rely on programs like Medicaid and CHIP, programs that are often on the chopping block, right? Mm-hmm. It's hard to plan and run a company or run a system if you are worried that the funding that you're expecting to help maybe in some of those areas could all of a sudden be cut. That has long-term effects on rural communities, right? What more needs to be done to ensure that there is that kind of continuity that might be missing?
Yeah. Well, a great example of that is the community health centers. So community health centers are a real lifeline for primary care for folks not only in rural communities, but including in rural communities. And yet they often facing exactly this kind of fiscal cliff.
Right.
No business person would ever attempt to run an organization where you were getting to 2 or 3 months, let alone 2 or 3 weeks, to the end of your fiscal support, and you're trying to figure out how to keep things going over that hump. We've done a lot of work on the HELP committee where I serve to try to do a strong reauthorization of the community health centers. And if we could do a better job of that, I think it would help a lot. Because we talk about, I think a lot about rural hospitals, but of course it's not just hospitals, it's all of the surrounding care that people need that help you to keep people healthy and not just treat them when they get sick.
We are almost out of time here, but you have a lot of advocates. You have people from the hospital systems, folks that are working on these issues on Capitol Hill, on the live stream. I always like to end on a positive note. We've talked a lot about the challenges, but what's the one or two things when you think about rural communities, rural health, that you're optimistic about or that you think people should be paying attention to?
Well, I think, first of all, I think that the strong bipartisan support gives me a lot of optimism that we can work this through. We can continue to make headway. The second thing is just seeing the innovation that's happening at the local level, not only around telehealth, but really across the board, and making sure that here in Washington, we are creating rules and standards that allows that innovation to happen. That's what we did with the Rural Moms Act. We said, okay, let's help rural communities figure out how to protect and maintain maternity care in rural hospitals, even if you are only delivering 150 babies a year at that hospital. Let's figure out how we can use telehealth. I mean, here's a great example in International Falls, a small community right up on very near the Canadian border, where because they have a partnership with a Sioux Falls-based company, they can pipe in through virtual connections specialty care into the emergency rooms, so that somebody who is maybe having a cardiac event and there are no cardiologists around, they can get that care in the emergency room immediately from those Sioux Falls doctors. That's the kind of innovation that I think gives me a lot of hope that we're going to be able to protect rural health care for communities and for the long-term viability of those communities.
All right, we're going to leave it there. Senator Tina Smith, thank you so much this morning for joining us.
Thank you. Thanks, Anna.
Really appreciate it.
Yeah.
All right. All right. Now I'd like to welcome Nancy Howell, AG, CEO of Carilion Clinic and chair of the Coalition to Strengthen America's Healthcare, for a fireside chat. Nancy. Welcome.
Thank you.
Thanks so much.
A pleasure.
All right. Well, we got to a lot with the senator. We're going to touch on some of her comments when it comes to challenges and some of the work that she's doing. But before we do pick up on those themes, I want to just share a little bit about you, kind of your road to your role here at Carilion Clinic, to get a sense of your perspective. So you serve as chair of the Coalition to Strengthen America's Healthcare. Talk a little bit about what that group is and what your mission is.
All right, maybe I should just start with who I am
Sure.
a little bit.
We'll do both.
And first of all, thank you, and thank you for having this summit. It's really important, and it's personal to me. And I want to thank the senator. Senator Smith is curious, she's interested, she's really putting a lot of resources into something that's very important. So I think she may have left the room, but I really appreciate what she's doing. You know, for me, first of all, healthcare is really personal. I think I started all this when I was about 4 or 5 years old, and I got a little nurse's kit for Christmas, and I had that little blue cape and a little bag and a dog, and so I taped him up and took care of all of his various pretend contusions and so on. And from that time on, I wanted to be a nurse. I guess like my grandchildren now want to be a fireman and a princess. And then when I was a teenager, I had a serious health event, and I was in the hospital for many weeks over a period of about 2 years, and I saw the incredible work and the care that physicians and nurses gave, and I wanted to be like them. So sort of fast forward, when I was about 22, I became a nurse, and then today I'm the CEO of a health system. We're a $2.5 billion company with 7 hospitals, 4 of which are rural. So the area that we serve, we call urban Appalachia. So we serve urban, suburban, rural, and very rural. And so this discussion of rural health care is just really personal to me and incredibly important.
I can't think of a better person to come sit and talk then. I'm so glad for you to share that. Talk a little bit, though, about the coalition. What is the group comprised of, and what's the mission?
So the Coalition to Strengthen America's Healthcare is just that. It's a coalition of the willing. It's a group of people who have come together to understand and advocate for America's healthcare, not just rural healthcare, but America's healthcare. And we're doing it with a sense of urgency. It's important right now, really focusing on letting our legislators understand the issues that are facing healthcare. It's not just one organization or another organization, it's those of us in healthcare. It also includes people in the lay people and so on, all really interested in the strengthening 24/7, 365 days a year healthcare that we provide in our hospitals.
So talk about that. Share a little bit about kind of what you were seeing. We talked with the senator about some of the challenges from her perspective, what she's heard from her constituencies. You, as you just said, I mean, you've got everything from urban to rural to just kind of hyper rural kind of communities that you're serving. What are some of those challenges and the demands that you're seeing in the rural communities?
Well, you know, and no one plans for a health emergency. Nobody expects to have an injury or an illness, and you don't do it 8 to 5. In rural health, in rural America, and actually I have a home in a rural area, and it's a pretty wide geography with 5,000 people living there. We were there this weekend, my husband and I, and it snowed. And so we decided to go follow the snow a little bit and went to a tangential county which 2,900 people live in, very sparsely populated. And as we're driving out of our driveway, we don't have cell service, we don't have broadband, and we're driving through this country road, and my husband says, what would we do if we had an accident? You know, and that's important because in rural areas, and there is a hospital in this community, it would be, for the most part, about an hour's drive from anybody in these two counties to get to a hospital. But absent that hospital, there would be a much further distance for them to drive. People in rural areas aren't all that different than anybody else, except that we see more poverty. We see people with more complex health needs because they haven't had access to health care. You see what we call diseases of despair, like obesity, alcoholism, substance abuse, suicide. You see that more often in the rural areas. And if you think about a hospital, today, in today's environment, it's hard to recruit and retain staff. There's a workforce shortage. Many people who live in rural areas are either what we call underinsured or rely on social programs. If you don't have a hospital where many of them are getting all of their health care, because that's where you have a physician, that's where you have nurses, that's where you have therapists, that's where you have technologists, and if you don't have that hospital, you don't have sort of the gravity around which you can provide health care. The American Hospital Association did a study recently, and nearly 40% of all people in rural healthcare, in rural areas, get their health care at a hospital outpatient department.
Yeah, talk about that. So talk about how rural patients sometimes lack that access to treatments that only hospitals provide, right? So you're kind of basically talking about the fact that they aren't maybe regularly seeing a doctor before they're actually sick, or there's some chronic, issues that hospitals are having to deal with beyond just the kind of emergency situation.
Oh yeah, I think, especially all hospitals, but especially hospitals in rural areas, treat very complex patients with a lot of chronic illnesses. And as the senator commented, then there are all the other social issues like adequate housing, adequate food, and so on. So you really see a different kind of patient in a rural setting. I'm worried about rural hospitals, though, and I'm worried about them because many are very fragile. More than 100 hospitals have closed, in rural settings have closed in the last decade and a half. Many more are right on the edge. And if they're not looking at closing, they're certainly shedding services. So it's rare, frankly, for you to see OB services in a rural setting, or pediatric services, or cancer care, or cardiac care. So, you've got a fairly basic but really important hub around which care is happening.
I I want to talk about some of the funding challenges in a little bit, but there were two things that the senator talked on that I want to make sure we also touched on. Senator Smith talked a lot about workforce challenges. So you're a nurse practitioner, a hospital administrator, you're seeing this from a wide variety of vantage points. Can you talk about that challenge, especially for rural communities, in terms of finding employees to work there, to have housing, to really kind of create a life and establish in that rural community?
It's recruiting and retaining the workforce today is concerning across the board.
Right.
And we have a workforce shortage. So imagine then what it's like in a rural setting to recruit and retain the important staff that you need for all the reasons that you just talked about. So it is more difficult in rural settings.
I also want to talk about mental health. Continues to be a major challenge in our country, particularly coming out of COVID. People are maybe talking about it a little bit more, at least at the kind of 100,000 foot level. But how big of a need are you seeing in rural communities when it comes to needing mental health care services, the ability to find providers for that?
So what we know about rural health care is that substance abuse and behavioral health issues are even more prevalent, and access to adequate care is problematic. If you look at the area that we cover, for instance, that's where the opioid crisis started and continues. There's some good news on the horizon, though. So the senator mentioned telehealth. We do a very significant telehealth service into the rural areas, and behavioral health is one of those illnesses that really responds well to telehealth. In fact, we found during COVID something so simple as the old-fashioned telephone actually works. For people who need a lifeline, who perhaps are depressed, having someone phone them. But telehealth is working well. But I did mention that we see connectivity issues in the rural areas. And so we've set up hubs in certain places, sometimes in the hospital, sometimes in the local library, even in some of the grocery store parking lots and so on, where we can provide connectivity for patients.
One of the biggest challenges, and we spoke about this in the previous conversation, is funding. Is trying to kind of piece together different kind of pockets of money, or the challenges of trying to kind of figure out all the red tape when it comes to Medicare Advantage and other issues. Can you talk about the underpayments of Medicaid and how that impacts rural hospitals?
So we're really grateful in Virginia for Medicaid expansion. It was a game changer for a lot of us, especially in the rural area. That said, many people in rural areas are underinsured or rely on social programs. And as the senator mentioned, Medicare, Medicaid don't really pay the cost of care. That's important, not charges, cost of care. And so, for example, it's estimated that Medicare pays about 80 to 82% of the cost of care. Rural hospitals don't have, a lot of days cash on hand. Their liquidity is pretty narrow, and so they're living on the edge. And I think we're expecting more and more from hospitals with less and less resources.
What, from your vantage point, are there things that you would hope that people in Washington would take into account, or are there programs or things that you think could be expanded that might be able to help some of those liquidity issues, or just the kind of precipice of feeling like these rural communities, hospitals might close?
So the 340B program is essential. Medicaid expansion is essential. I think the community health organizations are very helpful. But I think we have to look at longer-term solutions, not just short-term fixes. And I agree with the senator that the opportunity for innovation is enormous. And so providing some funding in rural settings, and there are solutions here. I'll tell you a couple of things we're doing. For instance, we're exploring drones. So we use drones to deliver supplies. And right now, legally, you can only do that in about a 10-mile radius. Well, we obviously have a much wider geography to cover, but we're working with some companies and the FAA to see how we can deliver with using drones. How exciting is that? My two newest employees, I say tongue-in-cheek, are two robots. And they're, life-size robots. They have a name tag. They have a little outfit on. And they're in one of our rural hospitals, and they're sort of the step and fetch it. They work right next door to the nurse, and the nurse can say, for instance, I need these supplies, I need linens, I need something from the pharmacy, maybe I need food delivered. And the robot goes and gets it and brings it back, saving the nurse time. And the nice thing about a robot is they work essentially 20 hours a day and don't complain.
There you go. None of the employee benefit questions that you might otherwise be getting.
But you would think that we would use, and we do use robots in our more, larger tertiary, quaternary hospitals. But we tested this out in our rural hospital on purpose because we have staffing needs. And I'll tell you, it's been incredibly exciting. It's working, and I think we'll expand that to other areas. But the innovation's what's important. So if we could tell our legislators and our staff to help us to understand not to decrease funding, but also help us find ways, find solutions. So what are some of those innovations that we can roll out in our rural settings?
It's interesting because innovation is kind of the heartbeat, not to get too, of healthcare in so many ways when you think about medicines or other things. But it sounds like you're trying to find really creative solutions here to challenges, that otherwise without innovation might not be solved.
Yeah, what's the old saying? Necessity is the mother of invention or innovation. So telehealth, really important. Yeah. But you have to have connectivity to have telehealth, and you have to have either an iPad or an iPhone or something that you can connect with. That's not always true in rural settings, and so we pay attention to that. But telehealth is really important. I think the use of things like robots could make a real difference. Like I said, drone up. But there are other solutions. And you asked the question about funding. I want to take that a little step further and talk about connectivity with other resources. So whether they're churches, whether they're local businesses, it takes a village, so to speak. And that's really true you see in a rural setting.
We are quickly running out of time, but before I let you go, I want to close here by asking you, this is how we often end these conversations, but you've got a room full, literally full, standing room only, of folks who are interested in this issue, are working on Capitol Hill, are advocates for it here in DC. We have folks, streaming in. What's the one takeaway from our conversation today that you want to leave them with?
I think the one takeaway would be we're serious. Hospitals in rural settings are in jeopardy. It doesn't have to be that way. We can find new ways to deliver care that makes sense, that's part of the economic vitality and viability of rural areas. And so let's get to work and find those solutions.
All right, I love it. Nancy, thank you so much for joining me this morning. I really appreciate it. We are going to take just a short break for a stage set before our final panel conversation. Thank you so much.
Heather Cagle, Managing Editor of Punchbowl News. I'm so excited to be here today. I'm going to welcome a panel of industry leaders who can talk about what they're seeing firsthand in their rural communities. So I'd like to welcome Carolyn Leha, CNO of Corewell Health, Dustin Lipson, President of Primary Children's Hospital, and then Secretary Mike Espy, former Agriculture Secretary and board member for One Country Project. Thank you guys for joining us. First of all, thank you all so much for being here. We've heard a lot today about the challenges in rural communities when it comes to healthcare. We've also heard about innovations. So I want to kind of start out on a bright spot. We will get to the challenges, I promise. But Carolyn, I want to start with you. When it comes to your community, what is the biggest issue you're seeing, but also what is an example of innovation you're seeing that can help address this issue or is already addressing this issue?
Sure. So I serve 2 hospitals that are part of a pretty large system that services the Lower Peninsula of Michigan, and they're both very rural. And I think the biggest challenge is access to care for several reasons. And I'm proud of some of the work that we're doing to solve that. We are really employing virtual methodology to help with that. We have some virtual nursing going on. We have virtual specialty consultations in our inpatient unit where we can really have access to that medical center type care, but keep patients really local. Mm-hmm. And we have partnerships with our community, which really help us as well.
And when you say virtual, do you mean telehealth or?
Yes.
Yeah.
So I do mean telehealth. So one of the things that we can do with virtual nursing is actually have a nurse working virtually that can provide really detailed, helpful discharge education, helpful transition when you're going from hospital back into the community, making sure that care is seamless. And what it does is frees up those nurses at the bedside to provide that acute care.
Dustin, I want to go to you next. You have talked a lot about innovation in healthcare. What are some children's healthcare specific issues, though, that you're seeing and dealing with in your community right now? And how is innovation helping you address those issues?
Yeah, it's a good question. I think that in children's healthcare, the problems we see on the adult side are probably even more acute in children's. So we've seen roughly 20% of children's units close in the last 5 years in the U.S. And so access, not only in a rural setting, but even in larger metropolitan areas is a real issue. It's a workforce challenge and it's an economics challenge. So for us, we are also focusing heavily on telehealth and virtual health. Everything from simple primary care visits virtually to specialty care visits to critical care in the hospital, in the ED, in a rural setting. You're able to beam in, a 3-year-old who was found by the pool in a rural setting, brought into the ED, in the emergency room, on screen with a pediatric emergency medicine doc, 4 hours away, then a pediatric critical care doc 4 hours away. And they're actually helping manage the care of that child in that emergency room in a rural setting. Not paid for, not reimbursed well, not the infrastructure, not the time of the docs, not the time of the other caregivers who support all of that. It's a reimbursement challenge. But that care is being delivered today by systems that I think are seeing this as a part of their mission, but not necessarily a part of the economic equation to make the system work. So that access to specialty care in particular is a real challenge.
You bring up a really interesting point because I think during the pandemic, all of us probably relied on telehealth to some degree. And I think when I first think of telehealth, I think of being at my home, and seeing a doctor there. But like you said, often in these rural communities, you might be in the emergency room, but you are able to bring in a specialist. So you're in a hospital, but able to get care that you wouldn't otherwise get at that hospital. Is that right? That's
right. Yeah, I mean, at Primary Children's in Salt Lake, 30% of our patients travel 3 hours or more to the hospital. It's thousands of people traveling long distances. And it's because you can't get that care anywhere else, that kind of heavy specialty, complex care.
Secretary Espy, I want to ask you, we were talking just before we went on stage, I'm from Alabama, which is next door to Mississippi. I think our citizens have a lot of the same issues,
Yes.
You've written about how people's attitudes towards telehealth evolved during the pandemic. Have you seen this continue to have a positive impact on rural healthcare, particularly mental health, which is something that you've discussed before?
Well, first of all, thank you so much for inviting me to Punchbowl News. I'm checking my phone because I hope that we can offer some breaking news today from Mississippi, because in Mississippi, the legislature, they're in their last month of their convening, and still not yet on the chopping block is Medicaid expansion in Mississippi. Now, governor is opposing it, but I've learned last night that the rank and file legislators have achieved a veto-proof majority.
Wow.
So I do believe that maybe even today, tomorrow, there will be some good news, for most of us, good news coming out of Mississippi on Medicaid expansion. You know, Mississippi taxpayers pay for Oklahoma health care, other rural health care in other states. So it's been my message, not just former Secretary of Agriculture, but as a Senate candidate, that we need Medicaid expansion in Mississippi. And I think that even in conservative red Mississippi, the news now is beginning to resonate, because most of the cost of this is being paid by the federal government, at least for the first couple of years. So I'm checking my phone. I hope we have good news today. But to your question on telehealth, you know, rural healthcare services have so many challenges today. And one way to overcome this is by innovative services in telehealth. But there's another problem, because in my state, which is still very, very, very largely rural, we have a lack of broadband access, you know, high fiber optic cables. Now, thanks to the Biden Infrastructure Act, we now have billions of dollars coming into Mississippi and similarly situated rural states to connect, you know, patients to health care, to provide broadband so that we can have innovative institutions like that. So we need everything we could get. We have a problem with lack of access, hospitals are closing, Medicaid expansion, as I said, hopefully we'll have it, but we don't have it yet in Mississippi. But we do have Medicare under reimbursements. So people have to go where they can get the best health care, if it's from their phone, if it's from their doctor. In Jackson, which is the only critical care hospital we have, we need telehealth.
You brought up Medicaid expansion. I was going to get to this later, but I'll stick with it now since we're talking about it. One of the debates in Mississippi had been attaching a work requirement, which a lot of advocates said would make it unusable for many of the patients who need that care. What is the latest there? Have they gotten rid of that? You seem hopeful that they are going to be able to bring the expansion there.
I'm hopeful, but I'm not joyful yet. I'm not going to be joyful until I get some news. But the governor is trying to throw obstacles in the way, and the governor is very influential. So now they're trying to make sure that there are more and more work requirements, you know, as a precondition to becoming eligible for Medicaid in Mississippi. And the preconditions are becoming, in my view, more and more onerous. But you have to work anyway, right? I mean, you have to work anyway to receive this benefit. So it's being watered down. There are influential politicians that are throwing objections in the way, but I'm hopeful that most of the leaders in Mississippi now are no longer blinded by the fact that this is a state like Mississippi with chronic prevalence of diseases like asthma and obesity and heart disease, that it just makes sense. You know, particularly if the federal government's going to pay the lion's share of it to provide the citizens with this type of eligibility.
Right. Dustin, earlier you mentioned the economic incompatibility of some of this care and the resources financially just not being there. Can you speak about Medicaid underpayments and how that's impacted your community and what other challenges you're seeing in this area?
Yeah, I think one aspect of this is the financing piece, and Medicaid, of course, plays a really important part of that. But I think the truth is that there's probably, rarely enough to go around to do everything we need to do. no question that these children's units are closing, as I mentioned before, because there's just not enough resource. And they're closing in these smaller facilities where they're less scale, and so the costs are naturally higher. So I think not only do we need to do everything we can to support Medicaid broadly, I think we also need to be innovative about the way we think about financing. So there is a number of state initiatives, creative ways that I think states can get involved. For example, in Utah, we have a partnership with the state to do what we call stabilization and mobile response. It's a behavioral health program. We drive out to the house when the family's in crisis instead of them coming into an emergency room. It's much lower cost. It's much more effective, much lower rates of remission. We work with the family for 6 weeks. That is a state-private partnership. It actually saves the state money on the Medicaid side. There are other examples like that where we can be doing things that are beneficial, but you need legislative support, you need unique financing mechanisms, you need advocacy, and you need to bring the private players around the table to make that work. So I think Medicaid is huge. We need to do everything we can to support it. We also need to get more creative.
Carolyn, you're nodding. Do you see these same issues? Do you deal with them in your community?
Absolutely. And I think, the challenge with us in rural spaces, we have an aging population, so we're dealing a lot with Medicare, and we talked about the reimbursement being about 82 cents on the dollar, which is a huge challenge for us to be able to then innovate,
right,
and think of programs that we can expand or do differently or partner differently because of that. We also have a fair amount of pediatric care in my spaces, and a lot of that is behavioral health and mental health concerns. So we do have some creative partnerships with our local schools through grant funding where we are actually able to provide telehealth behavioral health care to high school students in our community. And again, we need the financing, we need the continued support around that to be able to continue to provide those really vital resources for our communities.
Secretary Espy, you've served at the federal level. We heard Senator Smith earlier talk about several bipartisan bills that they're trying to get through Congress. Congress, especially right now, is not known for bipartisanship, I'll say.
For sure.
What do you think, how big is the federal role here? Or is it federal, half state, or local community? Like, who is the big player here to help solve some of these issues?
It takes a team, right? It takes federal, state, and it also takes local. As Secretary of Agriculture during the first Clinton administration, our job was really to do all we could do to promote and preserve the viability of rural America, and not just in farms, but also in hospitals and clinics and the citizens that they serve. When you go into most rural areas anywhere in the country, there are three big drivers of economic development. It's going to be the farms, it's going to be the schools, but it's also going to be the hospitals. When the medical clinics and the hospitals begin to close, for all the reasons that we've discussed this morning, you have a real problem in that community. So it's up to the state to do something about it, but also the citizens. And this is something I also want to highlight before we close today. The citizens should also take responsibility to making sure that we can keep these hospitals open. In Mississippi, as in Alabama, we've seen closure after closure after closure, mostly because of the financial difficulties that they face with Medicaid and Medicare under reimbursements. But I think to your question, the federal government offers multiple opportunities, and not just Medicaid expansion, and not just broadband connectivity. There's also a program I like to highlight, and that's tax credits. Through the U.S. Treasury Department's community development organizations are able to have the benefit of accessibility of tax credits to build clinics in their communities. I know this to be a fact because I just stepped down as chairman of such a CDFI, Community Development Financial Institution. It's called Hope Enterprise Corporation, which has been in operation for 26 years. 26 years ago, we started with $1 million, and I stepped down as chairman last January at $1 billion. Wow. So because of tax credits and the tax opportunities that the federal government offers to willing investors, that agreed to invest in a social mission, we were able to build clinics in some of the medically underserved areas in Mississippi. So they get the tax credit, right, when the tax credit expires. The CDFI has a loan, and sometimes through the generosity of the federal government, sometimes that loan is extinguished. So these are things that are on the offerings of the federal government that we should not ignore.
I think you all have touched on a really interesting theme here that I want to highlight, which is you have to be innovative, not just when it comes to technology for healthcare, but also getting healthcare to people
Yes.
and getting it funded. Most of the time, you probably don't think of tax credits, right, when you're talking about rural healthcare, at least not me. So that's a really interesting point. Dustin, I want to talk a little bit about workforce development. What is it like where you are in trying to recruit practitioners, nurses, other healthcare providers? How have you had to think creatively and innovatively in this space to get people, and is this still an issue?
Yeah, it's absolutely still an issue. I think that, again, another theme that I hear that we've talked about is creativity. And I loved some of the comments earlier. A couple statistics that come to mind for me when we think about pediatric, children's specialty care. There are a significant number of specialties, for example, that this past year, we're producing new specialty physicians through fellowships every year, and there's a number of them that matched less than half of their slots this year.
Wow.
So we already have a shortage, and now you're exacerbating that shortage by filling less than half the slots available. Geneticists, diabetologists, endocrinology, rheumatology, these are very rare folks. And we have, for example, we serve 400,000 square miles in our geography, 6 states. We have 5 pediatric rheumatologists.
Wow.
So when you talk about not filling a slot, for example, it's a really big deal. And that's true nationally. So, whether it's at the physician, subspecialty physician level, or it's all the way down to finding behavioral health specialists. We all know the crisis we face with mental health care. We have 30-40% vacancy rates with some of these roles that are require much less education, but are still extremely important to the care team. So we have to find new ways of creating roles, developing training, building our own programs, recruiting from other fields, at pretty much every level of the spectrum of labor. So huge issues across the board. Again, creativity, and I think that hopefully with more support, again, this is also a federal issue with things like CHGME, our graduate medical education funding. But those kinds of rural healthcare workforce funding initiatives alongside of creative ways to bring those folks into the community, again, it has to be a partnership.
And what do you think is the biggest barrier right now to getting more of those providers and other healthcare practitioners into these roles? Like, if you're them, why are you not wanting to come serve these communities?
Well, I can tell you in the case of the specialty physicians that I mentioned, when you do the 3 years of fellowship in genetics, pediatric genetics, or in pediatric rheumatology, when you graduate, your paycheck is actually lower than if you had not done those 3 years of additional training at a much, much lower salary.
Wow.
It's that truthfully, the market is broken when it comes to financing these types of specialists. And again, it comes back to because the reimbursement system is broken. Because when you go to negotiate a contract with an insurer, the payment you're receiving for that, or from the government in the case of Medicaid, is too low to compensate for the care of those individual specialists. And therefore, the salaries get depressed, and then people go to search out a career where they can actually make a living as a doctor that recognize them for the value that they contribute. So huge issue around reimbursement and salaries.
Wow. That's an amazing statistic. 3
Yes.
years, extra training, lower salary.
Yeah.
Carolyn, I want to talk to you about maternal health. It's something we've heard in our first 2 panels. It's an issue that is front of mind for many Americans. It is probably particularly acute in rural communities. Is this something that you're seeing? Are there technologies or innovations that you're seeing that are helping address this standard of care, which is much lower in the United States than other similar countries, as we've seen?
Sure. So I definitely think maternal health and access to maternal health care is an issue in rural spaces. I'm fortunate in my hospital where we do provide OB services, that's not the case. And I think there's a couple of reasons why, and then I'll touch on innovation a little bit. We're part of an integrated healthcare system, and we have a medical center in Grand Rapids, about an hour south of us, with maternal fetal medicine specialists, neonatologists, multi-specialty pediatric care that we can really tap into. So I think the bottom line for maternal health is we need hospitals that provide obstetric services available to rural women, and support of programs and reimbursements that would continue to foster that and support that are important. There certainly is innovation happening, which I'm really excited about. Some telehealth for behavioral health, mental health issues that can arise in pregnancy, which we know has become one of the #1 issues around morbidity and mortality for pregnancy in our country. There's also at-home monitoring for certain conditions like high blood pressure during pregnancy, which I think really helps bridge the gap when you have access or transportation issues. So for maternal health care, I think it's a both and. You have to have a really strong hospital, a rural hospital with maternal services, and then the resources to be able to innovate and go to women and families when needed.
That's a really good point, because I think maternal health care, more than some other healthcare issues, you really do have to be seen in person.
Absolutely.
And frequently.
Right,
You know,
and you need somewhere to safely give birth.
Right, exactly,
yeah.
exactly. Secretary Espy, I want to come back to you. I want to talk about the Medicaid expansion a little bit more. Covering politics for a long time, this has been an issue that Republicans, in particular Southern conservative states, have really fought against. Now we're seeing Republicans push this issue. Why do you think the attitudes have changed, and what's led to this evolution in thinking?
Politicians react to public pressure. Politicians react to what's obvious. In my state and in your state, Alabama, Mississippi, we've seen more and more hospitals closing. You know, 60 years ago, I almost died from an asthma attack because the rural hospital I was taken to had run out of oxygen.
Wow.
2 years ago, in Mississippi, an African-American woman in the Delta had an asthma attack, and they took her to the closest clinic, and they didn't know it had closed 2 months before, so she died. So 60 years difference between my incident and her unfortunate incident. And so everybody knows this. We all have friends and neighbors, and they're prevailing on the politicians to do it. So politicians react to public pressure. Number two, all these hospitals are closing. And as I said before, these hospitals and the clinics are the economic engines of these rural communities. And so they're creating this huge vacuum, and there's nothing to come into it. And that's why the people are protesting and encouraging their politicians to face the music. And number three, politicians like those in Alabama and Mississippi are looking to their sister states. These are red states. These are predominantly Republican states. In my state of Mississippi, we don't have a Democrat in statewide office at all. I tried to stop that 2 years ago and barely missed it. But they looked at their sister states in the states of the old Confederacy, and they adopted Medicaid expansion, and the sky didn't fall. The people became healthier. They had more access. There was just more vision and more optimism in these rural areas. And so they want the same. We have the same tax burden as states, upstates anywhere else. So we're paying for the Medicaid expansion in Oklahoma. We're paying the Medicaid expansion in South Carolina and North Carolina. So they're tired of it. And the sky didn't fall. Nothing happened. The people became healthier. The people became more optimistic. And the protests died down. And they were able to turn to other problems.
We're almost out of time, but before we go, I want to leave the audience, those on the live stream, the staffers here, the advocates, I want you guys to say, what do you want to leave them with? What is your closing thought, maybe from what you've heard today, or what you want to impart on them, what you would like to see? Carolyn, I'll start with you.
Yeah, sure, thanks. I think my big takeaway here, we've heard a lot about innovation, creativity. We really need investment in our rural hospitals as a foundation before we can do any of those things. So really would like to see programs that support our ability to think creatively, to innovate, to continue to provide those services while maintaining those hospitals that are really pillars in their community and the lifeline for so many rural Americans.
Dustin?
Yeah, I think I would leave it with that. I think the thing that people care about most, patients, our families, is health. They care about their health. And the only thing they care about more than their own health is the health of their children. And you know that when you're sick, the only thing you want is to be better. So from my perspective, supporting legislatively, economically, our healthcare systems, rural and urban, I'll take a special focus on kids. That will only do great things for every other part of our society. So I would just encourage folks to be involved and to continue to support this incredible mission.
Secretary Espy?
I'd like to leave on a note of optimism. America is a chain, and that chain is only as strong as its weakest link. And these rural communities, these are the weaker links and the weakest links in our chain. And so we have to focus on, the problems. And I do believe, I'm very optimistic that this particular administration is not ignoring the plight of rural America. We can see it through our broadband connectivity, through the BEAD program, the BEAD program. We can see it through their support for Medicaid expansion, even in states like Mississippi. And we can see it through all types of innovations, robotic delivery of drugs and telehealth. And so I'm very optimistic. This administration is not ignoring that blight. It's top center, and it's not being ignored, particularly investments like the one I discussed through the U.S. Treasury Department tax credits. We need those tax credits funded by the U.S. Congress so that we can expand.
Well, I always like to end on an optimistic note, so I appreciate that. I'd like to thank all three of our panelists for joining us today, and I'd like to welcome Anna Palmer back to the stage for closing remarks. Thank you so much.
All right, thank you, Heather, and thank you to all of our panelists. Really appreciate it. What an impactful morning we've had talking about rural healthcare, some of the challenges when it comes to funding, when it comes to care, the need for that 24/7 care. I really want to thank Senator Tina Smith and her team for agreeing to join us this morning and share about some of the work that she's been doing, particularly in a bipartisan fashion. As well as Nancy Agee for our fireside chat, talking about robots and some of the innovative things that they're doing out in Virginia to kind of think about the future of healthcare and how they can find ways to kind of overcome some of those challenges as well. A big thank you, as always, to the Coalition for Strengthening America's Healthcare for partnering with us and making this conversation possible. There's a lot of people who are working on these issues who are here this morning. I encourage you to turn to your right, turn to your left, meet somebody new. Punchbowl News is all about community, bringing people together to find new partnerships, to find new people that maybe aren't in your current circle. So really appreciate you coming here today. We have many more events later this month and in the next month. You can go to punchbowl.news and check out our events hub. Stick around for some networking. Have a great day and stay safe, everybody.